Let's memorize the diagnostic criteria for panic disorder. So first, we need to have a panic attack. What is a panic attack? It's an abrupt surge of intense fear or intense discomfort that reaches its peaks within minutes, and during which occur the following symptoms. So here we have 13 symptoms, and I like to remember them by going from top to bottom. And we need at least 4 out of 13. We can remember 4 by like head, shoulders, knees and toes, so like 4. Like, نمشي from the top. First, we have lightheadedness or dizziness. After that, in the face, we have sweating. In the neck, feeling of choking. And then to the heart, we have palpitations. The lungs, we have shortness of breath. And then for the chest as a whole, we have chest tightness. Then, in the abdomen, nausea or abdominal distress. Go to the peripheries, we have paresthesia and also trembling or shaking. And then as a whole, we have chills or heat sensation. And then the last 3, we have derealization and depersonalization, and then 2 fears. Fear of losing control and fear of dying. So let's go again. We have dizziness, sweating, feeling of choking, palpitations, shortness of breath, chest pain, abdominal discomfort or nausea, and then paresthesia, trembling or shaking, chills or heat sensation. Then we said depersonalization, derealization, and 2 fears, fear of losing control and fear of dying. This is the diagnostic criteria of a panic attack. And a panic attack is criteria A for panic disorder. Then we need criteria B is at least one of these attacks is followed by 1 month, at least, of one or both of the following. Persistent concern or worry about an additional panic attack or their consequences. Or 2, significant maladaptive change in behavior related to the attack. So it's either persistent worry or maladaptive change. This needs to be 1 month, it continues for 1 month following the attack. And then criteria C, disturbance not attributed to the physiological effects of a substance or another medical condition, hyperthyroidism, cardiopulmonary disorder. These are very important to rule out when we're taking history. And lastly, the disturbance is not better explained by another mental disorder, and which are the anxiety disorders, which we also need to rule out. So hopefully now it's a bit easier.